more like preparing or one of the
Coaching.
I did
coaching.
pray.
Yeah, but no,
No, I agree.
you're not being
Telling you what to
scared.
say. And
Yeah, yeah, exactly. This is all from the heart.
Both of yours are beautiful.
Mm.
If I can. Oh, this is perfect. Okay, so.
You can hit all four simultaneously or like
Yeah.
one after another.
Yeah, TikTok is having trouble right now. It's having trouble connecting to the Wi-Fi.
If you want.
Besides that, I think every camera has both of you guys.
Okay. What I'm going to do is let me connect to that Wi-Fi. Just 1 second.
Mhm.
I got it. Oh, this is very nice.
Okay.
Are you live here?
I'm live on each and every camera. So live. Yeah. Okay, smile for the camera. Why not? Let's take a photo. You want to?
Okay. You can go ahead and please get the TikTok live now.
Okay.
I'll go ahead and get started. All right. So.
I need to do one more thing before that happens. I just need to turn on the button.
Got it. Okay.
Okay.
There's something I can do for you?
No, I mean, I can come around and do it. It's no issue.
So I'm going to go ahead and get started, Ish. All right.
Yeah, if you guys can speak into the microphones.
Okay. Perfect.
Let me know if I need to adjust anything.
No, we're good.
Yeah, like fairly close to
Okay.
the mouth area.
All right. Okay. All right. So good evening, everyone. It looks like we're on for live with the Zoom, TikTok, YouTube, Instagram, and Facebook. So it is a warm welcome for me to introduce one of my patients. We're blessed to have you and share your journey. Remember, this is all about the patient. The single most important thing here is we have to listen to the patients and we have to see what is the problem that they're coming in with, what is it that we can offer, and how we can help them so that you and I are on the same page. And this is truly part of what is informed consent. So please tell us about yourself. How old are you?
I am 64 years old.
The next question is, when did you get your implants and how did you get them?
I got my implants in 2013, and it was because I had a very extensive family history of breast cancer. Although I was not diagnosed at that time, it was recommended that you have prophylactic bilateral mastectomies if you had a strong history, and I had 3 different cellular components of pre-in situ, different types of cancer cells, precancer cells.
Got it. Now, you were tested for the BRCA gene.
I
correct?
was, and
Yeah,
it was negative.
But despite that, given the strong family history, you still opted for what is a prophylactic nipple-sparing mastectomy.
Exactly. And one of the reasons I did, Dr. Khan, is because my life work was as a dosimetrist in radiation therapy working with cancer patients. And one of my specialties was working with breast patients especially. And I knew that early detection is early cure. And I also believe that I worked in a field that didn't want to do harm but wanted to cure patients.
Right. Now, I have to say that it's a tough field because everyone is fighting cancer and you're helping each one of them. And
Dr. Khan, before you guys continue, I'm just checking the mic picking up things, and if you guys could speak up and also speak into the mic,
got it. Okay.
it'd just be much more helpful.
All right. Okay. So, officially, this is very important for the listeners. 1 out of 8 or 9 women will get breast cancer. And so this is a statistic that is very real. And we all know our neighbor or some family friend or a relative who has had breast cancer. And so screening is very important. The single most important thing that one can do is a self-monthly breast exam at the right time, such that you're screening for breast cancer. And number 2, right up there, mammograms. It is not a perfect test, but truly millions of patients' lives have been saved by early detection of breast cancer. Many patients have had early detection of DCIS and they did not need to undergo chemo or radiation. So this is very much indeed the standard of care. Thermography is not the standard of care. You will see if you do your research, there is a 30 to 50% depending on the study miss rate, and you do not want to do a study where you have that many misses. So mammogram is certainly the way to go. Nowadays you have CAD, AI, basically enhanced readings, and plus you have computer animated design slash screening mammography, diagnostic mammography. There are other so many modalities, including ultrasounds that will aid, enhance, and then certainly as the breast center is going to dictate an MRI if needed or a biopsy. Now, a very important point that you mentioned, that you prophylactically opted for what is a mastectomy, even though you were BRCA gene negative, and despite that, you had given your strong family history that was positive. Now, you had your implants in 2013 with silicone or saline?
Silicone.
Silicone, and they were under the muscle.
They were under the muscle.
Correct. Now, as is done, you had alloderm reconstruction, correct?
And at the time, to be honest, I had the Allergan implants put in. I was put into a study because it was the first go round of the textured implants for Allergan. I did not know, Dr. Khan, until you and I reviewed the paperwork, that they used Allergan, that false fake tissue in my body. I had no
Alloderm, yeah, alloderm,
I had
alloderm.
no known that
Yes.
that was used on my body.
So in the United States, a vast majority of the reconstructions, well, almost 85%, depending on the surgeon, the technique, their training, 85% of the surgeons use alloderm, which is cadaveric skin that has been processed, cleansed off, the antigens have been removed, and now they're used as a scaffold to hold this relatively large implant. And so the surgeons essentially suture it to the muscle such that it holds the relatively heavy implant. And so it offers for a sturdy reconstruction, if you will. And so that is almost always, like I said, 80-85% of the times used, depending again on the surgeon's training. So so in 2013 is when you got your tissue expander placed, you got serial expansions, if you will, and then when you reached a certain volume, you had that tissue expander removed and it was replaced with what is a silicone implant. Now, when did you get your explant?
I got my explant in October 30th of 2025.
October.
Can I just mention
Yes,
here
please.
one thing that I really think that there's a huge disconnect for women that have had a diagnosis of cancer or pre-diagnosis of cancer, or that go through mastectomies, because you are encouraged, rushed, pressured to put back in your body what you've lost, which is an implant. And I really think that when you are not given the opportunity to look at risk versus reward, and it's not explained to you that what tissues you're going to have put in your body, the length of time that the implants can exist in your body without causing damage, which you've read many times, the warnings by FDA and the warnings from the manufacturers. None of that was given to someone like me or patients, I don't even think today, when you are in a place in your life after a diagnosis where you can actually digest that information. No one takes the time like you took with me to go through my paperwork, give me a chance to digest it, to tell myself the truth about what was happening to me, and then work with a patient to come to the best decisions with knowledge and doing their homework. You're just pushed forward into, this is what I'm going to do, what's next for you, and you don't do that with your patients.
No, thank you very much. See, this is again part of informed consent. The moment you find out you have had a mastectomy or you have cancer, all of a sudden the mind goes numb. You go to someone and they'll say, jump off the cliff, and you're like, okay, which side of the cliff? Let me jump. And so you're essentially now dependent on your significant other, your family, friends, best friend who's going to accompany you. And remember, when you're on the hot seat, you're not processing, you're not digesting, and you're not letting that sink in. And unfortunately, I will say this, having heard this from a lot of patients, option number one is do nothing.
Yes.
DNT, which means do not touch, meaning that's it, flat chested to from the very beginning, And this is an option that should very realistically be given to the patients because this is absolutely a choice. Now, the second option here is to do the implant-based reconstruction. Now, this is another fact that the vast majority, well, almost 90% of the reconstructions that are done past mastectomy are implant-based reconstruction. And so this is where it is automatically assumed, well, go to this room in the breast center, you're gonna see the plastic surgeon, automatically this is what you want, this is what you deserve, this is the best thing for you, and you deserve the best. And this is essentially the entire black box warning that is basically should be and must be discussed, was never truly discussed because the patient never truly comprehended what that even entailed. And so my recommendation is, if you go to Google and type in breast implants, certain labeling recommendations to improve patient communication, guidance for industry and Food and Drug Administration staff, it should be guidance for industry, FDA staff, and patients. Document issued September 29, 2020, U.S. Food Drug Administration, September 29th, 2020. This is by the FDA. So if you look at the black box warning, you will hear exactly, breast implants are not considered lifetime devices, close quotes. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. The other thing to mention here is patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others, period. Individual patient risk for developing these symptoms has not been well established. I just want to mention here, this is telling you that breast implant illness indeed does absolutely exist, because they're telling you have reported a variety of systemic symptoms such as joint pain, one of the hallmark features of breast implant illness, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. The next line says, some patients report complete resolution of symptoms. Complete resolution means cure of symptoms when the implants are removed without replacement. Now, thanks for bringing this up, because what's interesting is in 2025, when you opted for the explant, you did not get a replacement. Why?
I did not get a replacement because I had been in such pain with my implants. I had a lot of the BII symptoms, but I didn't know that they were BII
What were the
symptoms.
symptoms?
I had a lot of joint pain. I had felt like my body just was fatigued all the time. I couldn't get back to my normal standard of quality of care for exercising, for optimal health. I just felt like I just was behind the eight ball. I kept having injuries to my arms, torn tendons in my arms, like I was stretched too far in my neck and my shoulders and my arms. It just seemed like it was one thing after the next that just kept going bad for my body. And I just knew that something, before COVID, I looked into getting them out and went to 7 different plastic surgeons in 3 different states, including Cleveland Clinic, and was made to feel that I would be doing a huge disservice if I had them out and did nothing to put them in their place. To have them just removed and to do nothing would be degrading to my body and to the female form. And it was very difficult to hear those kind of words. So when I found a surgeon here, because I had planned to go and have that surgery done in Texas, and then it was right before COVID, and 2 weeks before we were supposed to go down to Texas to have it done, the surgery was canceled because of COVID. And then I think I just kind of lost the steam to get it done. And then went in for a kidney stone in September, met a nurse there who had gone through, had nipple sparing. You talk about people putting people in your path for you to get the answers that you need, and got to talk to me about symptoms and why I was there and what had been experiencing in my body. And when I told her, she said, I think that you have breast implant illness. Have you ever looked into any of those signs and symptoms? And she said, I encourage you, when you leave today, go home and look that up. I know a surgeon, he did my surgery, he took out my capsules, took out my implants. This is someone you need to go see.
Word of mouth.
Word of mouth. And so I didn't do my homework. So let me stress, when I came to you, the first thing Dr. Khan told me is, you need to do your homework, and this is where you need to go and look for what your questions you need to answer, educate yourself. I trusted, and I went to the plastic surgeon in Toledo in October, and it wasn't until I woke up from the surgery that he told me that he had not removed my capsules, just the implant. I had relief immediately from the cold that I had been experiencing for the duration of the 13 years I had my implants. That was the beautiful part of that surgery. But
For how long
within-
was the relief?
The relief from the cold has been complete. Never came back because the implants were no longer sitting on my chest wall cold. But my other symptoms, 3 days, maybe 5 days, and then all of a sudden I started feeling worse than what I felt before in my body. The fatigue was worse. I'm thinking, well, maybe it's just because post-surgery. But then I developed a seroma on the right. Then I developed a seroma on the left. The one on the right dissipated. The one on the left kept getting bigger and bigger and bigger. And one night I just literally, I'm a believer in God. I just didn't know what else to do. I literally just folded down to my knees, cried in my hands and said, I need help. I need to find someone that knows what they're doing, that can honor me as a woman and my body and what I'm going through and what I've been through. And I picked up my phone and I thought, ChatGPT, let me write out all of the things that I need from a surgeon. Let me write down the qualifications. I need to have somebody that deals with their patients with honesty and integrity, that will actually listen, that's been doing these, that has an expertise, that has a process. I wrote every single one of my things in there, and hand to God, your name was at the top of the list. And then I said, thank you, because you were within driving distance. I didn't have to go to another state.
Mm.
That next morning, I called and made an appointment to come in and see you. When you got my information, instead of you having me wait to come and see you when I could get in for an appointment, you actually called me on the phone on the weekend and began our communication and our process, and gave me an opportunity. For the first time, I had a physician that would listen. I had a physician who, by our conversations, had compassion for women like me that were going through this. And you had the expertise of the words, but you made it important that I do my homework and educate myself so that I didn't walk in again blindly. Is it okay if I complete the story? When
No,
I came
please,
in and
please
saw
go
you
ahead.
for
This
the
is all
first
for
time.
you. Yeah, yes.
When I came in and I saw you for the first time, I was not expecting the conversation to go the way it was, and was expecting, because I had been told by my plastic surgeon that they could just go in and do a needle aspiration of the seroma and everything would be fine. And you explained to me that that couldn't happen because of the potential of injury for releasing those fluids into my body, that we needed to get the seroma out and the capsules out, and that was why I had not been feeling better. And you also told me that I would know if this was the right decision for me, because I would have not only peace in my heart, but I would also have the feeling of hope and of joy. And you said it may happen at 2:00 in the morning. Just trust that it will happen for you. And I knew in my core, because I knew when you showed up in my life that there was a reason on the ChatGPT. I knew when I came into your office and the way you dealt with me with honesty and integrity, that you were the doctor for me. And so I went ahead and made the decision for the surgery, even though I did not have that peace and that joy. And I trusted your words, and I trusted the process, and I went home and I prayed over the next couple of days, and I realized that I had been afraid in the past to stand up for myself with physicians, and I finally had a physician that I could stand up for and ask questions to and not feel like I was going to be talked down to and that wouldn't listen. And called back to the office and said that I had some questions, and you made time for me, and I talked to you on the phone and explained to you that what the desires of my heart were different than what our conversation was in the office, and that I needed you to be honest with me, that if you weren't the physician for me, if you weren't the surgeon for me, that could give me what I thought I needed and that I wanted, that could you recommend someone else? And you listened to me with your whole heart, and you said, when I came into your office, you said you told me that you were my surgeon and that we worked together to come to the best care for the patient that is before you. I felt like an individual. I felt like my words mattered. I felt like you took my body and my situation individually and made it as important to you as it was to me. You heard my words, you listened with a heart, with sincerity, you honestly gave me the truth. You didn't give me the impact of telling me the negative things that would happen to my body with my choice. You shared with me the like pros and cons, only there I can't the verb. I'm still having a little bit of brain fog, but that's getting so much better. You shared with me the risks and reward of the decisions that we were making, and you told me that if there was any way in your power that you could give me what it was that I was asking for, because it wasn't the norm, because I did go through nipple sparing and areola sparing, and I didn't want my body to look like a science project. I do have some vanity that I'm still working with within myself, but that was important to me. And when you talked to me about the risks as far as a cancer diagnosis, and we talked about the fact that I never was given a specific cancer diagnosis, but I understood that when you tell women your first concept as a physician, and any physician out there should be first to do no harm. And that rings so many bells true. And if there's women out there that are doing things or hearing doctors telling them to do things that could harm their bodies, do harm to your vessel, to tell you that what you're feeling isn't real, for BII, that it's not true and it's not real, it is true and it is real. And when you have a physician that's willing to take your hand and walk with you down this journey and not have the definitive role of, I know I'm going to tell you how you need to take care of yourself, I'm going to tell you what's good for you. You listened and we made a game plan together, still knowing and trusting that if things didn't go the way I wanted them to, that you were still going to take care of my body and make the decisions that were best for me on the table. And we understand full communication about that, and you hid nothing from me and kept open in communication with me, and were tender and gentle the whole entire way.
No, this is, thank you so much. Your words are so strong. You need to have that triple with the bond with your surgeon. You need to have that unshakable faith. There's so much that you have said that I want to kind of elaborate on. When you went to your surgeon in 2025 to get the explant and you knew you were done with the implants, what's interesting about the whole thing is if you went to the 1,000 top plastic surgeons in the country, all of them would inevitably have said, get the implants, because replace them, do not just remove them, because you're not going to be happy with what you are. And I will say this is again enforcing what their recommendations would be and not honoring your choice, because you were done with the implants. And this is where, the case that I did today, a nice lady in her 70s at the hospital, she had both ruptured implants. Now, I promise you, had she had gone to a plastic surgeon or 100 plastic surgeon or 1,000 plastic surgeons, all 1,000 of them would have said, we'll take these bad set that you had placed in Bangkok, and she had her surgery done in Bangkok in 2003, and that they were just going to replace them. And she said, no, I know better, I just want them out. Now what's interesting is if you go to 10 different plastic surgeons, nowadays you'll find 100 of them, or even 1,000 of them. You go to any prominent city in the US, every top plastic surgeon is going to be offering an explant, and you will see all 1,000 of them are going to have their own formula, on the job training, their own thought process, their own mindset, their own experience, and their own comfort level on your case, one side being different than the other side. And this is where that whole confidence, that whole unshakable faith, that religious feeling that you're going to be completely religiously removing the entire capsule, no matter how tough the case is going to be, no matter what length of time, and that there is complete dedication to removing the capsule and doing it right. Because I'm sure you did your homework. You said you already had reached 7 surgeons. Now this is where a lot of surgeons out of good faith said, well, I don't believe in breast implant illness, but I will try to honor you because I don't want to lose you as a patient, because they have to pay their bills. You will see vast majority of them in their heart, deep down within, if you knock on their heart and soul, they're like, we're not believers in BII at all. We're just doing this to get another patient. Even those 10 surgeons who are supposedly only explanting, I promise you, I know this, They're only doing it for the best, just so that they can say that they're doing it, but they're truly not, because deep down within, their partner is putting in implants. And this is what I find, unfortunately, a problem, because now they're just saying it in order to lure the next patient in. This is that one point you have to and you must do your homework. There are so many patients who are unfortunately going to a surgeon who has not even talked to the surgeon. The patients have not even talked to the surgeon, and they're showing up at the surgeon's doorstep without even having had a word with them. This is very scary.
It is scary.
You cannot rely on an influencer or a social media spokesperson or another person who was once a nail salon expert to be holding someone's hand in the operating room and showing that this is how the surgery is going to be done. Are they the ones who are going to be operating, or is the surgeon going to be operating? And so you have to do your homework, talk to the surgeon directly, and you have to have that firm bond with that surgeon, that that surgeon is going to do the surgery. Number one, it needs to be on the consent form that the capsule must 100% be removed, no questions asked, no denying the fact that, oh, I'm gonna try my best and depending on what I find. There is a surgeon who reached me from France and he said, are you sure you're doing a capsulectomy total on each and every single patient? I said, you bet. Why don't you go ahead and the surgeon is already on my private breast implant on the support group page. I said, why don't you DM each one of my thousands of patients, and why don't you go ahead and see the high definition pictures and videos of the chest wall? Because that is the one and only proof. That is the one and only proof that your surgery was done in the manner as described. Because I find that many surgeons just fill in the blank and say, I did a capsulectomy. Now you do not know if it's total or partial. Or they said they did a total because they know you're not going to go in and check. And unfortunately, these surgeries are being done in 90 minutes, 2.5 hours with fat grafting and a lift and a supposed explant. And how is that even humanly possible? Now, this is where, once the case is easy, the surgeon is showing that the capsulectomy was performed, and here you go. But the next patient, the next tough case, this is where the surgeon is not showing. The surgeon must, from one patient to the next, consistently, purposefully, deliberately show the patient the high definition pictures and videos of the chest wall showing complete removal of the capsule, as you saw.
Yes.
As you saw.
And like you taught me, when we removed the seroma, which was left over from the capsule, you were able to take it out in block fashion. I do not think that would have been done for me. I think they would have given me a needle aspiration and left that fluid in, which we found on the pathology had potential cells going the wrong direction, going in a not healthy direction. So that tells me, and thank God, Dr. Khan, I'm just going to throw this in there too. The study that you're embarking upon to take to the FDA about people like me whose capsules get left inside of them cause damage, they cause harm. You know this, and trying to get the education out to women. Please don't leave your capsules in. You need to have them removed. There's nasty things inside those capsules that have held the leaching from the implants that you've had in your bodies, and you don't want that dumped into your chest wall. You want it all removed, so that in the inflamed tissues, anything that isn't good, you want that stuff removed. And that's something that Dr. Khan, you do with your process. You do with the care that you give to each person that comes across your.
So any patient that comes to me gets a total capsulectomy, period. Preferably an en bloc or 100% total capsulectomy. I have had 3 patients over the last year and a half, now almost 2 years, that were CD30 positive. They already got their surgery correctly done to begin with. I did not have to call them back and say, I need to go back and remove some of the residual capsule. Many of the surgeons, unfortunately, cauterize, burn the capsule right on top of the chest. And I have talked to them, they have talked to me, and I have done Facebook Live interviews with them.